Welcome back, welcome back, welcome back. Thanks for tuning in to my channel once again. My mission is to educate and spread awareness about illness and real life situations through this channel. The information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. Don't forget to hit the like button and subscribe to my channel at the end of the video. This week's video will be about colon cancer. This will be a two-part series. Next week we will cover colorectal cancer. A healthy colon is essential to an efficiently working digestive system. If one part of your digestive system isn't working right, it can interfere with the overall process of breaking down food and removing waste from the body. The digestive system consists of the mouth, esophagus, stomach, and small intestine. Each part has a unique role in breaking down and absorbing calories and nutrients from food. The adult colon is about 5 to 6 feet long. It's divided into 4 regions. The ascending colon, which is located on the right side of the body. This portion synthesizes bacteria and vitamins that remain in the stool. Transverse colon, located between the ascending and descending colon. It crosses the abdominal cavity and runs right to left. This is the largest part of the colon. Water absorption occurs here. Descending colon, that sits between the transverse and sigmoid colon. It stores the remains of digested food that will be emptied into the rectum. Sigmoid colon, that's the last section of the colon that attaches to the rectum. It holds the feces until you are ready to go to the bathroom. The body absorbs nutrients and calories as the food moves through the small intestine. Leftover waste, mostly liquids, travels to the colon. The colon removes water from the stool and balances electrolytes and the pH. Bacteria in the colon helps the digestive process. Involuntary muscle movement called peristalsis, which helps move the stool to the rectum to be passed during their bowel movement. For some people, it takes about 36 hours for food to work its way through your digestive system and pass from the stomach to the rectum. Bacteria in the colon have important functions. It synthesizes certain vitamins, it protects the body from harmful microorganisms, it processes the remaining food particles and helps maintain proper pH balance. Colon cancer begins in the large intestine, which is the colon. It typically affects older adults but can happen at any age. Most times, it begins as a small non-cancerous clump of cells called polyps. The polyps form on the inside of the colon. Polyps can become colon cancers. Polyps have few, if any, symptoms. Colon cancer is sometimes called colorectal cancer, but is actually a different cancer. This type begins in the rectum, which we will cover next week. When a cell's DNA is damaged and becomes cancerous because cells continue to divide even when new cells aren't needed. As the cells accumulate, they form a tumor. Cancer cells can grow to invade and destroy normal tissue nearby. Cancerous cells can travel to other parts of the body to form deposits there that's called metastasis. Colon cancer stages. The stage refers to the extent of the cancer or how far it has spread. Primary tumor, how big the original tumor is and whether the cancer has grown into the wall of the colon or has it spread to nearby areas. Regional lymph nodes. This stage refers to if the cancer cells have spread to nearby lymph nodes. Distant metastasis. This refers to whether the cancer has spread from the colon to other parts of the body like the lungs or liver. Cancer stage classifications. The disease is classified even further and assigned a number or a letter to indicate the extent of the disease. The classifications are based on the structure of the colon and how far the cancer has grown through the layer of the colon wall. Stage 0 is the earliest form of cancer, of colon cancer, and this means it has not grown beyond the mucosa or the innermost layer of the colon. Stage 1. At this stage, the cancer has grown into the inner layer of the colon called the mucosa and the next layer, the submucosa. Stage 2. This stage is a little more advanced than stage 1, and the cancer has grown beyond the mucosa and the submucosa of the colon, staged as 2A, 2B, and 2C. 2A, the cancer has not spread to the lymph nodes or nearby tissue, but has reached the outer layers of the colon, but has not completely grown through. 2B, the cancer has not spread to the lymph nodes, but has grown through the outer layer of the colon and to the visceral peritoneum. 2C, the cancer is not found in nearby lymph nodes, but has grown through the outer layer of the colon and has grown to nearby organs or structures. Stage 3. 3A, the cancer has grown to or through the muscular layers of the colon, and if found in nearby lymph nodes, it has not spread to distant nodes. 3B. The tumor has grown through the outermost layers of the colon and penetrates the visceral peritoneum or invades other organs or structures and is found in 1 to 3 lymph nodes, or the tumor is not through the outer layer of the colon wall but found in 4 or more nearby lymph nodes. 3C. The tumor has grown beyond the muscular layers and cancer is found in 4 or more nearby lymph nodes, but not distant sites. Stage 4. 4A. Cancer has spread to one distant site, such as the liver or lungs. 4B. Most advanced stage of colon cancer. This stage indicates the cancer has spread to 2 or more distant sites, such as the lungs or liver. Colon cancer, also classified as either low grade or high grade. Pathologists examine cancer cells under a microscope. They assign a number 1 through 4. The higher the grade, the more the abnormal the cells look. Low grade cancer tends to grow slower than high grade cancer. The prognosis is better for people who have low grade cancer. Colon cancer symptoms. Early stages of colon cancer often show no signs or symptoms. Symptoms tend to vary based on size and location in your large intestine. A persistent change in your bowel habits, including diarrhea or constipation, or a change in the consistency of your stool. Bleeding rectal or blood in your stool. Persistent abdominal discomfort such as cramps, gas, or pain. Weakness or fatigue. Unexplained weight loss. Colon cancer risk factors. Doctors aren't sure what causes most colon cancers, but there are many risk factors and they are as follows. Older age. Majority of people 50 and older. African American race are more at risk of getting colon cancer than people of other races. History of polyps or colorectal cancer. These things increase your risk if you have had polyps or colon cancer before. Inflammatory intestinal conditions like Crohn's disease or ulcerative colitis increases the risk of colon cancer. Inherited syndromes. You have an increased risk of colon cancer if you have gene mutations that's passed through generations of your family that links to inherited genes. Family history of colon cancer puts you at a greater risk of getting colon cancer if a blood relative have had colon or rectal cancer. Low fiber, high fat diets. Research shows mixed results for this, but some studies have found increased risk of colon cancer in people who eat diets high in red meat and processed meat. Sedentary lifestyle. People with inactive lifestyles are more likely to develop colon cancer. Diabetes. People with diabetes or who are insulin resistant have an increased risk of getting colon cancer. Obesity. Increased risk of getting colon cancer and increases the risk of dying of colon cancer compared to people of normal weight. Smoking causes increased risk of colon cancer. Alcohol. Heavy use of alcohol increases your risk. Radiation therapy for cancer. Radiation therapy directed at the abdomen to treat previous cancers increase the risk of colon cancer. Colon cancer diagnosis. At around age 50, visit a gastroenterologist doctor to request screening for colon cancer, especially if you had or have any of the risk factors that we covered a little bit ago. Discuss any symptoms you may have or experienced previously. The doctor will do a physical exam, order blood tests, and one of many imaging studies. Colonoscopy is the most common test used to view the entire colon. The doctor uses a long, slender, flexible tube attached to a video camera. They sedate you and insert the tube up your rectum. If anything looks abnormal, the doctor is able to take biopsies for analysis, and they can also remove polyps. The blood test. There's no blood test that can determine if you have colon cancer or not. The doctor does labs to get an overall view of your health. They may also test your blood for a chemical sometimes produced by colon cancer called carcinoembryonic antigen, or CEA. CEA levels can increase when colon cancer is present. Presence of CEA at diagnosis may affect how well you respond to treatment. The CEA in your blood can also help your doctor understand your prognosis and whether your cancer is responding to treatment. Screenings are important because they allow the doctor to view the colon to see if anything looks wrong, like polyps or abnormal growth. Early detection increases the chance of stopping cancer's growth before it starts to spread. Virtual colonoscopy. This test, which a radiologist uses x-rays and a computer to create images of your rectum and your colon from outside the body. This test can show ulcers, polyps, and cancer. Flexible sigmoidoscopy. Medical staff uses a flexible, narrow tube with a light and a tiny camera on one end and inserts it into your rectum to look at your rectum and lower part of your colon. This test can show irritated or swollen tissues, ulcers, polyps, colon, and rectal cancer. It can also find the cause of unexplained symptoms like bleeding from the anus, changes in bowel activity like diarrhea, pain in the abdomen, or unexplained weight loss. Fecal occult blood test. This lab test is used to check stool samples for hidden occult blood. Occult blood in the stool may indicate colon cancer or polyps in the colon or rectum. Other diagnostic tests may include imaging of the abdomen, liver, and chest, such as CAT scans, X-rays, MRI scans. Colon cancer treatments. Many factors will affect your outlook, including how well you respond to treatment, your age, your cancer grade, and your overall health at the time of diagnosis. Typically, each stage of cancer is treated differently. Stage 0, surgery is usually the only treatment needed. Stage 1, surgery alone is recommended. The technique may vary based on the location and size of the tumor. Stage 2, surgery to remove the cancerous sections of the colon and the nearby lymph nodes, and chemotherapy may be recommended. Stage 3, treatment includes surgery to remove the tumor and lymph nodes followed by chemotherapy, and sometimes radiation therapy may also be recommended. Stage 4, treatment could include surgery, chemotherapy, and possibly radiation therapy. Sometimes targeted therapy is also prescribed. Avastin, Erbitux, Vectibix, Cyramza, Starvaga, Zaltrap are common target drugs used today. Targeted therapy can be used with chemo or instead of chemo. Targeted therapy drugs will only go after the cancer cells. It blocks specific abnormalities within cancer cells, and this treatment is used for people with advanced cancer. This treatment can be very expensive and it carries its own set of side effects. Immunotherapy, drug treatment that uses your immune system to fight cancer. Your immune system may attack your cancer because the cancer cells produce proteins that blind the immune system cells from recognizing the cancer cells. Immunotherapy works by interfering with that process. This treatment is reserved for people with advanced colon cancer. Radiation therapy uses powerful energy sources like X-rays and protons to kill cancer cells. This is used to shrink a large cancer before an operation so it can be removed more easily. Chemotherapy. This drug not only destroys cancer cells, but it also kills healthy surrounding tissues. Chemo may be used before an operation to shrink a large cancer so that it's easier to remove with surgery. Chemo decreases the risk of recurrence by killing all the cancer cells that remain in the body after surgery. Proton beam therapy. That's the newest radiation therapies. Proton beam therapy can benefit children, young adults, and those with cancer located close to critical organs and body structures. Proton beam therapy uses pencil beam scanning to destroy cancer cells while sparing healthy tissues. Supportive palliative care. Specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. Palliative care aims to improve the quality of life for people with cancer and their families. Colon cancer surgeries. Surgery for early stage colon cancer when the cancer is very small. Polyectomy. This surgery can be used if the cancer is small, localized, completely contained within a polyp at an early stage, and the doctor may be able to remove it during a colonoscopy. Endoscopic mucosal resection. Larger polyps could be removed during a colonoscopy using special tools to remove the polyp and a small amount of the inner lining of the colon. Laparoscopic surgery, used for polyps that can't be removed during a colonoscopy. This procedure is minimally invasive. Surgeries for advanced colon cancer. If cancer has grown into or through your colon, the doctor may recommend partial colectomy. A surgeon will remove the diseased portion of your colon and a small portion of surrounding healthy tissues. The surgeon is often able to reconnect the healthy portions of your colon or rectum. When it's not possible to reconnect the healthy portions of your colon or rectum, you may need an ostomy, which involves creating an opening in the wall of your abdomen from a portion of the remaining bowel for elimination of stool into a bag that fits securely over the opening. Sometimes the ostomy can be temporary and sometimes it may be permanent. Lymph node removal. Nearby lymph nodes are usually also removed during colon cancer and tested for cancer. Lifestyle changes to reduce the risk of colon cancer. Eat a variety of fruits, vegetables, and whole grains. Drink alcohol in moderation if at all. Exercise 30 minutes a day, most days of the week. Maintain a healthy weight. Regular use of aspirin or aspirin-like drugs. Colon cancer coping. A cancer diagnosis can be emotionally challenging. Learn enough about your cancer so that you feel comfortable making treatment decisions. The more you know, the more confident you'll be when it comes to making decisions about your own care. Keep friends and family close so that they can provide the support you'll need and they can serve as emotional support when you feel overwhelmed. Find someone to talk to. You want to find a good listener who will listen to you talk about your hopes and fears. It could be a friend, family member, counselor, medical social worker, or you can join a cancer support group. This has been your host, Imani. Thank you for tuning in to Minutes Until Fit. It has been my pleasure to spread awareness, and I hope this helps someone gain some knowledge. Don't forget to hit the like and subscribe button. Until next time, be safe out there.